Welcome back, students, to part 30 of our masterclass. I'm absolutely thrilled to have you here today. Right off the bat, if you are enjoying this lesson, please like, share, and subscribe to this channel and share it with friends for this free course on Decode Healthcare with Harshal. Okay, so today we've got a highly focused and incredibly important explainer queued up for you. We're stepping right into the obstetrics section of the ICD-10 PCS codebook. Now, you know, this is a section that often trips up even seasoned medical coders, mainly because it operates by a slightly different set of rules than the rest of the surgical chapters. But don't worry, we're going to break it all down step by step so you completely master it. Before we jump in, remember that in part 29, we tackled the tricky rules around coding multiple procedures and discontinued operations. We looked at how to handle those really specific situations where a surgery doesn't go exactly as planned, or when a physician has to address multiple body parts in a single operative session. Mastering those foundational guidelines perfectly sets the stage for today's complex topic, where precision in defining the exact procedure is absolutely paramount.
Let's take a quick look at today's agenda. We've got an obstetrics overview, Section 1 versus Section 0, key root operations, coding products of conception, and finally, a masterclass summary and teaser for our next lesson.
Starting off with Section 1, Obstetrics Overview, Setting the Boundaries.
So the golden rule here is that all codes reporting an obstetrics procedure provided to a pregnant woman admitted into a hospital will always begin with the number 1. The obstetrics section is dedicated strictly to care provided during pregnancy, labor, and the postpartum period. Now, the relationship between an obstetrician and a patient can last many months, right? But in the inpatient hospital setting, we're only coding for the acute care procedures provided during that specific admission window. If it meets these criteria, character position 1 is an automatic 1.
Moving right along to Section 2, Section 1 versus Section 0, knowing when to switch.
Now, this is a classic trap for students on their certification exams, so pay close attention here. You might think, well, the patient just gave birth, so any procedure she has right now is an obstetrics procedure for sure. But actually, not necessarily. If you're coding a non-pregnant female reproductive procedure or even a postpartum urethral repair, you literally must exit Section 1 and use Section 0, medical and surgical. Why is that? Well, because a urethral repair is performed on the mother's specific anatomical body part, the urethra. Section 1, on the other hand, is almost entirely focused on procedures performed on the products of conception, which we're going to define a lot more clearly in just a moment.
Let's dive into Section 3, key root operations, decoding the action.
The source guidelines give us precise definitions for abortion, delivery, and extraction to really ensure we capture the exact clinical scenario. In Section 1, you only have 12 root operations to choose from, but they require very careful interpretation of the physician's operative report. You have to translate common medical terminology into these highly specific ICD-10 PCS definitions. Remember, the root operation, which is the third character in your code, always defines what the physician actually did. So a really crucial point here is that the root operation, delivery, designated by the character E, is strictly reserved for a natural, manually assisted vaginal birth without instrumentation. If the physician simply supports the natural process of a vaginal delivery, you assign delivery. It is quite literally just assisting the passage of the baby from the genital canal. If any extra mechanical force or surgical incision is introduced, we can no longer use this specific root operation. Conversely, if the physician uses forceps, a vacuum pump, or, say, performs a D&C for a retained placenta, it immediately becomes an extraction, coded with the character D. Why? Because a pulling or stripping force is being applied to remove the products of conception. The main objective changes from simply assisting a natural passage to physically extracting by force. If the doctor places a vacuum cup on the baby's head, that's extraction. If they manually turn the fetus using internal version, again, that is extraction. Write this down for your exams and definitely highlight it in your notes. A cesarean section is surgically pulling the baby out, meaning it's always coded as an extraction, never delivery. Even though colloquially we might call it a cesarean delivery, in the precise language of ICD-10 PCS, the physician is surgically extracting the fetus via an open approach. So a C-section will always have D as its third character. This is a fundamental concept you absolutely must commit to memory. Next up is Section 4, Coding Products of Conception, defining the anatomical focus. So now we need to understand the fourth character position, the specific anatomical site we are treating. In the medical and surgical section, this might be the stomach, the liver, or a specific artery. But in Section 1, the true patient of the procedure is often the products of conception,
which comprehensively includes the zygote, embryo, fetus, placenta, amnion, and umbilical cord. The fourth character will almost always be a 0 for products of conception, a 1 for retained products of conception, or a 2 for ectopic products of conception. The mother's body is basically merely the environment. The actual target of the procedure is the POC itself. This perfectly ties back to what we discussed earlier. If you're operating on the mother's own organs, you often need to jump back to section 0.
Let's walk through a practical example here. If a physician removes an ectopic pregnancy endoscopically via the vagina, we build the code character by character. The section is obstetrics, 1. Body system is pregnancy, 0. The root operation is extraction, D, because we're pulling out the tissue. And the body part is ectopic products of conception, which is 2. The approach is natural opening endoscopic, giving us an 8. And with no device or qualifier, we end up with the complete code 10D28ZZ. See how logically that builds?
And for a diagnostic amniocentesis, we use the root operation drainage, character 9, because the objective is letting out amniotic fluid. The target body part is again the products of conception, 0. The approach is percutaneous, 3, because we're using a needle right through the skin. Notice the 7th character qualifier, U, which specifically denotes that the fluid being drained is amniotic fluid for diagnostic testing. The final code is 109030. This perfectly illustrates how each of the 7 characters tells a very specific part of the clinical story.
Section 5. Masterclass Summary and Teaser. Wrapping up Section 1. To quickly summarize today's lesson, Section 1 is exclusively for the pregnant female, specifically targeting the products of conception. If you operate on the mother's distinct anatomy, you gotta check Section 0. And never forget that high-yield rule. A simple, unassisted vaginal birth is a delivery, but the exact moment you introduce forceps, vacuums, or perform a C-section, you're coding an extraction. That wraps up our obstetrics explainer. We've covered the boundaries, the root operations, and the exact codes you need to succeed on your exams. So keep practicing those 7-character builds, and I leave you with this. Are you ready to navigate the complex pathways of the heart in Part 31 Cardiovascular System Procedures and Coronary Interventions? If you are enjoying this lesson, please like, share, and subscribe to this channel, and share it with friends for this free course on Decode Healthcare with Harshal. Thank you so much for joining me today, and I'll see you in Part 31.